Good morning, my dear friends. Myself is Professor Dr. Rajendra Deshpande. Today is a Wednesday, 20th March 2019. In this moment, this is audio book regarding Ayurvedic Bhasma, Ayurvedic Pishti and Ayurvedic some Rasayana products. Audio book regarding Bhasma, Pishti and Rasayan, these three varieties of the Ayurvedic medicines. My dear friends, actually I am making these audios regarding the Ayurvedic medicines because I feel that as much as the different types of or varieties of the medicines you know in your brain, then it is very easy to practice in particular Ayurvedic field. Now let us talk about Bhasma. Dhatu Bhasma. I think whenever one wants to understand a specific science, it is the duty of the learner to understand the basic terminology of that particular science. If I want to visit Germany, then it is better that I should learn German language. If I want to visit France for my educational purpose, it is better to learn some French language. Similarly, if anybody is interested to know about Ayurveda, then it is basically need to understand some specific terminology of Ayurveda. Let us start with the word Dhatu and the Bhasma of the Dhatu. Now the Dhatu word in the Ayurvedic physiology has a different sense, different meaning, like they are compared with the body tissues. Rasa, Rakta, Mausa, Meda, etc. But when I talk about Ayurvedic medicines, when I talk about Ayurvedic pharmacology, when I talk about Ayurvedic pharmacy, production of the medicines, then Dhatu word is regulated with metals like gold, copper, silver, etc. Now, this particular Bhasma concept is very popular as well as very useful in the Ayurvedic medical practice. Ayurvedic Vaidyas at a national level, India, they are very happy because they get a very good strength and power to cure the complicated problems of the patient with this type of Bhasma type of the products. But if you cross the boundary of nation, then immediately in the foreign countries, there is a rising of the eyebrows. Oh my God, Ayurveda using metals? How it is possible? Because as per knowledge of the chemistry, as per knowledge of the modern medicine, they have learned that metals are toxic to the human body. Then Ayurveda is using Bhasma, Ayurveda using metals. Then they get surprised, rather they get shocked, they get afraid, and then because of the fear, because of the afraid, they start some criticizing or making a rumors. That means false notations in the mind of the people, confusing the mind of the common man at the national level as well as international level. They publish some articles and they say that Ayurveda is non-scientific. They don't know the chemistry and biochemistry. But my dear friends, those who want to criticize, I kindly request all these people basically come to the genuine, experienced, knowledgeable person of Ayurveda, go to the standard manufacturing company, visit their R&D, try to understand the basic terminology, try to understand the process behind that particular product. And then if you have any doubts, then get it clarified at the same moment, at the same place. And unless and until you do this particular job, there is no right to any person whatsoever he may be. He may be the teacher, he may be the researcher from the modern medicine, he may be the top, what you can say, the chemistry person, but there is no right to him unless and until he himself understood all the knowledge of Ayurveda and Ayurvedic pharmacy and the Bhasma concept, then he has no right to criticize the particular science or particular product. Okay, this is on the one side. But at the same time, my dear friends, Ayurvedic friends, teachers, students, researcher, let me clear the fact that we are also make ourselves improved by making our quality products. Because if you want to use the products from the mercury and sulfur, which are called as the rasakalpa, if anybody wants to use the metallic bhasma, then it is better to go for genuine Ayurvedic manufacturing company. Personally, I in whole of my life use the products mainly from the Baidyanath company. Also Ayurved Rasashala Kottakal from the South India. They have also now the preparing the bhasmas. They have also the capsules of the bhasmas. I believe on this particular manufacturing companies. Of course, it is not like that all other companies are fake, but it is a personal duty, personal caution that one has to check from where we are getting these products, especially related with the rasakalpa, that is mercury and sulfur, and another metallic products. Okay. So one side I have appealed to the modern people of chemistry and modern people of medicine to understand thoroughly the concept, get the experience of it, look by your eyes R&Ds of the Ayurvedic manufacturing companies, and then you can talk or you can discuss whatsoever you want. And secondly, on the other side, I am appealing to my students, Ayurvedic practitioners, Ayurvedic teachers, make a propaganda of the genuine products and buy the products, use the products from genuine manufacturing company. Why? Because if you are not following the Ayurvedic guidelines, Ayurvedic scientific principles while manufacturing, if you are making any shortcuts in the manufacturing process, that may get a problem in quality of that particular product, and when the under quality product is prescribed by the Vaidya or under quality product is consumed by the person, then it is definitely the person will suffer from hepatotoxicity, nephrotoxicity, cardiac problem, brain problem, this and that can ruin not only the reputation of that particular prescribed making Vaidya, but that can be the disreputation of the Ayurvedic science unnecessarily. Unnecessarily is more important. Now coming to the point, metals, when somebody translate it that dhatu bhasma are the ashes of the metals, this is, I can say, easy translation to understand a little bit, but that is can make a false confusion in the mind of the people. Is it only ash? Bhasma means only ash? No, my dear friends, not at all. Explain the modern people, explain the chemistry people, it is not only ash. Because when you making a ash, they assumed it that you have to only take the copper, for example, copper plate, just give the extreme heat till it becomes brittle and black color. That's it, that ash. But is it that black ash of tamra metal is a tamra bhasma? No, my dear friends, not at all. When we take the metal, there are lot of things we first check as a raw material. We have the standardized protocol even made up by the Ayush. We have the books where how to select the metal, from which geographical area, from which particular part it should be taken. Then that raw product is processed. First, that particular metal or all the metals are made purified. It is not directly burnt. First purification is there. Remember my words. So dhatu shuddhi, and there is a Sanskrit quote, taile takre gavan mutre yarnale kulathaje. I know there is a little bit fear about Sanskrit. Don't worry, I will explain. Taile takre gavan mutre yarnale kulathaje. That means Ayurveda says that this particular metal like copper, it has to be heated till it becomes red color, red hot, and then we have to dip it in the sesame oil. Again heat on the gas fire till the red hot. Again dip it in the sesame oil. Taile. 7 times you have to process this. Then again heat it till red hot. Put it in the buttermilk. Takre. Taile. Takre. Again 7 times. You understand? In each liquid, that particular red hot metal is dipped 7 times, again it is heated, again dipped. So this process takes a long time. Gavan mutre, you have to put it in the cow's urine. So every time that metal molecules get changed, their biochemistry, rather chemistry I can say. Chemistry is changing whenever we are hitting the metal and putting in different medicinal substances. Ayurveda believes that sesame oil has particular quality. Buttermilk has specific quality. Gavan mutre, cow's urine, specific quality. Particular water prepared from the kulatha, horse gram, it has some own particular property. Kanji, it has its own property. Actually, metallic purification, I am very fortunate to tell you that there is one video, remember, on YouTube. I have uploaded 300 plus videos. Please, my dear friends, visit to that YouTube by channel naming Rajendra Deshpande. Then there you will find a playlist. In the playlist, you go for Ayurvedic medicine preparation. And there you can see this video, how we make the dhatu shuddhi, purification of the metals. Now, what is happening with the purification? That it is a detoxification process. Whatsoever the toxic property is present in the tamra or the copper or the silver or the gold or the any zinc, it is getting rid of. It is being removed, that toxicity. Number one. Secondly, the good properties are enhanced. For example, I want that gold should have the more property of anabolic, or the copper should have the more property like catabolic, or making a stimulation to the liver. Then positive properties will be enhanced and negative properties will be nullified by dhatu shuddhi prakriya. And what next happens? The most important is its totally lost is hardness in that particular metal. No hardness will remain. Originally in the raw form, each metal is having a typical type of hardness. That hardness is totally lost and then it becomes so brittle. Then this particular purified dhatu, we also gave a lot of fire at a very high degree and for a longer time. When we put the fire to make its ash, that process is called as putta. Putta is given. Putta is a Sanskrit word. Putta is Ayurvedic terminology. To give the putta and to make a bhasma, to prepare the ash. So giving the putta is very much essential. Dhatu bhasmikaran is also called as a marana. Marana kriya, making death of the toxicity and making a rejuvenation of the positive properties. Marana kriya. Then what is happening with this? There are different types of the furnaces are used, different types of vessels are used. So just I quote the different words like gaja putta. Putta means fire, furnace. How much degree centigrade, how much degree Fahrenheit the heat should be. Details I am not going to discuss because this is not a lecture on the Ayurvedic pharmacy, but basically I am clinical pharmacology I am discussing, but this is an introduction. I am giving an exhaustive introduction for before starting this Bhasma Kalpana of Ayurveda. Now, you can see after conversion into the Bhasma or typical type of the ash, I will not say only metal ash, but it's a processed metallic ash. Processed metallic ash, that can be more perfect translation of the Dhatu Bhasma. Don't say only metal ash, then it is a confusing. Most interesting part, at that time, thousands years back, these Ayurvedic scientists had a very crucial knowledge about the basic elements. Now we are talking about, in the recent years, atoms, electrons, protons, neutrons, and the latest is the nanoparticles. Nano is at the moment minutest structure of any element. Ayurveda says that these particular level of nanoparticles should be acquired by that dhatu bhasma. And how to test? Ayurveda in the olden days always believing on the clinical approach. First clinical approach and then laboratorical approach. So what they are giving the hints? They have given different tests, T-E-S-T. How to test that my dhatu bhasma is perfectly prepared. So the name of the test are, first is a Rekha Purnatva, second Vari Taratva, and last Apunarabhava. Rekha Purna. Rekha means lines, the lines on my fingers. You can see how minute lines are there on your first phalange of the finger. So when you take the bhasma in the two fingers, like the index finger and the thumb, and just roll in between, you will find that the particles enter into the lines and you will not feel any roughness. That is called as the Rekha Purnatva. Vari Taratva. Vari is a water. That particular bhasma particles, they float on the water surface. So much lightness is there. No gravity. So subtleness is there. And apunarbhava. That means if you send a sample of copper or tamra bhasma into the laboratory and ask them, give me the analysis, they will not say it contains some original copper raw form. No, not at all. It is not possible. It is a converted form. Remember, original tamra or the original copper will not be found punarabhava. It will not exist again, because we have already dyed all the raw particles or the toxic particles from the copper, from the tamra bhasma. While preparing the tamra bhasma, marana kriya was there. Great heat is given to that particular product, and that is why this is very, very, very nanoparticles, most potent particle. They can enter into the micro channels of your body. They can reach up to the nervous tissue, up to the bone marrow. They will not act only superficially on the skin level, on the muscle level. No, they have the property to treat any complicated diseases which have a root at a deeper level in the body. So that is the speciality of bhasma concept. Next, I will talk about Pishti. Remember, before that, let me clear. Now you have fully convinced that dhatu bhasma or the specifically processed metallic ash is never have, if the quality product is there, it will not create any hepatotoxicity or any renal toxicity. Remember these words, because the patients are afraid to take this particular bhasmas. Now it is the duty of each and every Ayurvedic scientist, teacher, chemist, they should explain what is really these bhasmas are and try to relieve the phobia from the mind of the foreigners, from the mind of the modern people. Next, Pishti is also very similar concept like the bhasma, but basically Pishtis are prepared from the substances which are having cooling property. Remember, Pishti is cooling in effect. Majority Pishtis are prepared, the substances which are having cooling in nature. In the Pishti formation, direct fire is not given. Direct fire is not given in the Pishti. Most of Pishtis, because Pishtis are prepared to make that again substance into the conversion into the nanoparticles. But that is a process of rubbing, especially that processing trituration is done in the rose of water. Many times Pishti is prepared in the processing, in triturating in the rose water. I can give the examples: Moti Pishti, Panna Pishti, Manik Pishti, Trunakant Pishti, Jahar Mohra Pishti, Dagdi Bor Pishti. I have given totally 6 Pishti example: Moti pearl, Moti Pishti, Panna Pishti, Manik Pishti, Trunakant Pishti, Jahar Mohra Pishti, Dagdi Bor Pishti. Now, again coming back to the bhasma. My dear friends, some bhasma, especially of animal origin, when the original raw material is from animal origin, animal kingdom, then that bhasma requires very less fire compared to the dhatu bhasma or the metallic processed ash. I will give again 3 examples which can be prepared by giving only mild to moderate type of the fire, only 1 put. Put is a unit of giving the fire. Put is a specific term used to indicate how much fire, how much sittings are required of the fire, how many hours it should be given. So, Kukkutand Tvak Bhasma. Kukkutand Tvak Bhasma. Kukkutand Tvak Bhasma is an egg, hen's egg, shell. Tvak means shell. Kukkuta and Tvak, egg shell. Kukkutand Tvak Bhasma is available in the market. Ajasthi Bhasma, bones from the animals. Ajasthi Bhasma. Mayura Pichha Mashi. Mayura Pichha Mashi. Feathers of the peacock. For the medicinal purpose, with the typical permission from the government, you can prepare this type of the bhasmas or the pishtis from the animal kingdom with due certification from the government authority. Okay. And lastly, we can discuss some Pardhakalpa as a rasayana, that is Kajjali, Parpati, Sindura Kalpa and Pottali Kalpa. These 4 Pardhakalpa I can discuss: Kajjali, Parpati, Sindur and Pottali. My dear friends, myself, Professor Deshpande, audio book Bhasma Pishti Rasayana. Audio book Bhasma Pishti Rasayana, part 1 we are talking, it may require 2 parts. Now I will start talking about particular Bhasma, but I am not giving you very much details. I will concentrate on the clinical aspect and only give you where it can be used. What is the indication that is the most important for our practice? Let us start. Shankha Bhasma, like conch. Shankha, Shimple, Kaudya, Moti and Pravar. These are all what we can say the seashore animal products. Shankha, Shimple, Kaudya, Moti and Pravar. So this conch, Shankha Bhasma, all these products, they contain calcium carbonate. Calcium carbonate. And in the market, there is a combination available with the Shankha, Shimple, Kaudya, Moti and Pravar. Together, it's called as a Pravar Panchamruta. Pravar Panchamruta, which is used for many types of the different abdominal complaints like chronic colitis, chronic gas complaint, chronic indigestion complaint. Also, as all these products, Shankha, Shimple, Kaudya, Moti and Pravar, coral, pearls, conch, shells, all these things, they have the natural calcium source. Natural calcium source. So, in spite of using the artificial shell kala tablet of modern medicine, better to use these Pravar Panchamrut, or a famous tablet I many times used is from Vidyananda lab, Calbin tablet. Name of the tablet, Calbin. Write down, Calbin tablet to treat osteoporosis, osteopenia, osteoarthritis, muscular weakness, bony weakness. You can use this product with anemia. Calbin tablet, very useful. Shankha Bhasma. What is that Shankha Bhasma? Ayurveda says Shankha Bhasma is Grahi in nature. What is Grahi? Grahi is a typical term. Grahi means absorption due to the astringent property. Grahi, to absorb. Absorb the excessive watery waste product, that is kledha. Whenever there is excessive kledha, whenever there is excessive dravata, liquid, unnecessary, unwanted liquid is there in any substance, then Shankha Bhasma will absorb. Especially, it is very useful in the abdominal region when there is acidity complaint. But remember, my friends, remember, acidity is of two types according to Ayurveda, Sama Pitta and Nirama Pitta. When the Pitta is Sama, that means acidity arising originally from the indigestion, originally because of the heavy meals all the times, heavy food, not taking off the food, not following the rules, high calorie diet, obese person, then it is acidity is formed because there is increase in the dravata of the pitta dosha. It is not only ushna and tikshna. Dravata is first increase and then there is acidity problem. So in that case, abdominal colic will be there, indigestion will be there, sometimes diarrhea will be there, loose motions, dysentery will be there, colitis with mucus excretion will be there, irritable bowel syndrome, diarrhea type will be there. So in all these conditions, you can use the Shankha Bhasma. Tablets are available, powder is available. It has to be given with the lemon juice or the buttermilk. Simple. 1/4 of the spoon 3 or 4 times in a day with lemon juice or the buttermilk for all these type of complaints where the Sama Pitta is there. So Shankha Bhasma is basically acting in the abdomen, especially in the stomach region and in the colon region. Now, Kapardika Bhasma. Next will be Kapardika Bhasma. What is the difference in activity or the target organ of Shankha Bhasma and Kapardik Bhasma? Shankha Bhasma is preferable when there are problems in the upper GI tract. That is the basically stomach and the duodenum. But when the problem is more on the jejunum, ileum and large intestine, better to use Kapardik Bhasma. Both are having similar properties, no problem. But Shankha Bhasma for Urdhva Amashaya, upper part of the GI tract, stomach and duodenum. But Kapardik is for Grahini part, that is jejunum and ileum. Shankha Bhasma and Kapardik Bhasma both are Ushna and Deepana Pachana. Deepana is a stimulant to the digestive fire. Enzymatic secretions are increased, and Pachana is a carminative. It will remove the gas. It will remove the unwanted, undigested part. So, Kapardik Bhasma is very useful in the conditions of sprue, S-P-R-U-E, sprue. It is useful, Kapardik Bhasma, for chronic colitis. Kapardik Bhasma useful for the gas patient. Too much gas in the stomach, gas is passing from the rectum, gas is eructed. That is called as aerophagia. Aerophagia. Excessive belching, excessive flatus, fullness of the abdomen, gas. Abdominal colic due to the gas, pain in abdomen. So use the Kapardik Bhasma. It is very interesting that Ayurveda has mentioned a very, very different indication for Kapardik Bhasma. But it has to be very cautious while using the indication that I am mentioning. It is for ENT problem. For example, under the supervision of ENT, Ayurvedic Shalakya Tantra specialist, this can be used in otitis media. Whenever there is a chronic discharge from the middle ear due to some chronic infection, then with due precaution, cleaning first that particular part with the Johnson cotton bud, clean thoroughly that particular ear, and then under the supervision of only expert from Ayurveda, only after advice of the Ayurvedic Vaidya, you can put Kapardik Basma, a pinch with lemon juice, as a type of specific remedy mentioned in the Ayurvedic science. Kapardik Basma for otitis media, but under the supervision of expert. Next product is a compound medicine which is called as a Lokanath Rasa. Lokanath Rasa is Kapardik plus Tankan. It is used in the Lokanath Rasa, Kapardik Basma or the Kaudi Basma, and also the borax, that is Tankan. Kapardik and Rasa Parpati both can be used in the Grahani. Kapardik and Rasa Parpati, which is in the Lokanath Ras. So this Lokanath Rasa is very useful product for chronic enteritis and chronic colitis, that is Grahani. When this Lokanath Rasa is prepared with addition of gold or the Suvarna Basma, then that is called as Suvarna Lokanath Rasa. One is a simple Lokanath Rasa, another is a Suvarna Lokanath Rasa. That Suvarna Lokanath Rasa is useful in the chronic colitis, chronic diarrhea, and also when there are respiratory problems like asthma or the chronic cough due to the origin into the abdominal problem or the digestive problem, you can use this Suvarna Lokanath Rasa with ghee and sugar. Because the patient is debilitated, patient is having tuberculous enteritis, tuberculous abdomen, HIV diarrhea, there may be immune compromised patients. In all these patients, when there is a complaint of abdomen or respiratory tract, Suvarna Lokanath Rasa is indicated with ghee and sugar. Next Basma is a Pravala Basma or Pravala Pishti. Pravala is nothing but the coral found in the sea, coral Pravala Basma. There are two types of the products are available, Chandraputi Praval and Agni Puti Praval. Remember this, Chandraputi Praval and Agni Puti Praval processed in rose water, especially Chandraputi Praval is processed in rose water. Of course, the coral is a cooling agent, but Agni Puti Praval will be indicated problems of pitta with little bit indigestion, because Agni Puti will little bit stimulate your digestion process and make the cooling effect. But Chandraputi Praval is indicated when there is no history of any indigestion, rather history of taking NSAIDs, non-steroidal anti-inflammatory drugs, history of the alcohol intake, drunkard is there. When the patient is of Vata Pitta Prakriti, better use Chandraputi Praval. If Kapha Prakriti person is there, use the Agni Puti Praval. And this Pravala Pishti, Pravala Basma, the market products, two market products I will refer to you. One is a Godanti Mishrana tablet. Godanti Mishrana tablet. And another is Amruta tablet from Vidyananda lab. Amruta tablet from Vidyananda lab. What is that Amruta tablet? Amruta means Guduchi. So it contains Guduchi, Praval, Chandan and Jatamasi. Guduchi, Praval, Chandan, Jatamasi, which is having the coral, is Amruta tablet used for fever and acidity. Fever and acidity. Similarly, Godanti Mishrana tablet is also available with Praval, with Godanti Basma. Praval Pishti, Praval Basma can be used very well for different pitta originated problems. Some examples are burning hands and feet. Burnings, hands and feet due to the pitta prakriti, due to the summer season, due to the heat stroke, due to the drinking of alcohol, B12 deficiency, B1 thiamine deficiency, when you are prescribing neurobion injections for the peripheral neuropathy originated from the vitamin B complex. B1, B6, B12. Use better Pravala Pishti, Pravala Bhasma, Amruta tablet, Godanti Mishran tablets. There may be diabetic neuropathy. Use, my dear friends, Pravala Bhasma, Pravala Pishti, Godanti Mishrana tablet, Amruta tablet from Vidyananda Lab, Mumbai. What is another Pittaja Vyadhi? Burning micturition in the urinary tract infection. So this can be the supportive Pravala Bhasma. Then burning of the eyes, high fever, menopause, hot flushes is there. Then bleeding disorders, bleeding from the nose, epistaxis, hematemesis, hemoptysis, hematuria, purpura, thalassemia, any bleeding disorders, Pravala Bhasma, Pravala Pishti, Godanti Mishran tablet, Amruta tablet. As per necessity, use it. Maybe as a mainstream of the medicine or maybe supportive medicine. Next, more cooling, that is Mauktika Bhasma. Mauktika, Mukta means pearl. Mukta is very cooling. Remember, anti-pitta. It will control the Ushna and Tikshna Guna of Pitta dosh. It is very cooling in effect. In the market, Patanjali's Mukta Pishti Vati is available. Mukta Pishti Vati. My dear friends, use it for the controlling the hypertension originating from the stress in the Vata Pitta person. So, Mukta Pishti Vati will give the cooling effect to your brain, cooling effect to your nervous system. Mauktika Bhasma is more potent than Pravala Bhasma. But of course, it is very costly than the Pravala Bhasma, than the coral Bhasma. But Mukta, pearl, is the best cardiac tonic. So it should be used for the ischemic heart disease, congestive cardiac failure, palpitation. In the tuberculosis patient, when there is hemoptysis, use Mukta Pishti Vati with Vasa Ghrita. Vasa is a plant, herb, Adatoda vasica. Use Mukta, use Pravala with Vasa. Again the same indications for the Pravala. Diabetic neuropathy, use it, Pravala and Mauktik. Then, if you use the Mukta Pishti from the Arya Vaidya Nilay, they are saying that it is used for the avascular necrosis of the femur. AVN, avascular necrosis of the femur. It requires Pravala, it requires Mukta. So use these products for the degenerative changes in the head of the femur. That is AVN is avascular necrosis of femur. Next is the Shauktik Bhasma. Shauktik is a Shimple. There are two types, Mukta Shukti or Motyate Shimple and Shauktika Pishti. So this Shauktika Pishti can be graded, can be categorized in between Pravala and Mauktik Bhasma. Shauktik is at the potency level is in between Pravala and Mauktik Bhasma. So whenever you take the simple Shimple and give the Agniput, it becomes the Shauktik Bhasma. Shauktik Bhasma is usually used as like a Shankha Bhasma in the patients of Amla Pitta or the hyperacidity. So Shauktik Bhasma is similar to the Shankha Bhasma used as a Grahi in Sama Pitta where Drava Guna, liquid property of Pitta is more than the Ushna Tikshna property. Next product that I have already mentioned is Pravala Panchamruta. Pravala Panchamruta is also called as a Calcipral, which is a product of Ayurveda Rasashala Company, Pune. Ayurveda Rasashala, Pune, Maharashtra State, India. Calcipral, Pravala Panchamruta. It contains 5 ingredients like Pravala, Shankha, Shimple, Kapardik, Moti. Pravala, Shankha, Shimple, Kapardik, Moti. Pravala, Shankha, Shimple, Kapardik, Moti. And then there is a processed with latex of Rui. Rui is a specific plant. Ruita chick. It has been triturated in the Rui chick. That's why it becomes more, what you can say, the stimulant to the deepen and Pachana process. That means whenever there is Agnimandya originated problems, whenever there is a Samapitta, you must use Pravar Panchamrut. Pravar Panchamrut is more indicated in Samapitta than Nirampitta. In the Nirampitta, you can use only Pravar Bhasma or Pravar Pishti, especially Chandraputi Pravar. In the alcoholic patient, don't use Pravar Panchamrut. Use the simple Chandraputi Pravar Bhasma. In Pravar Panchamrut, because of the Rui, there is a Pitta Shodhana, because it is a mild laxative or the purgative. So, Rui is causing Virechana, which is a Pitta Shodhana. So, Pravar Panchamrut is used with lemon juice for all different digestive problems originated from Samapitta and not Nirampitta. As Pravar Panchamrut, Pravar, Shankra, Shimpla, Kapardik, Moti, it contains natural calcium carbonate. It can be used for all bony weakness, osteoporosis, osteopenia and osteoarthritis, where bone mass density BMD is less. Use Pravar Panchamrut. So my dear friends, this is nearly 40 minutes and I know that there is some tolerance limit to hear any lecture. So I conclude, myself, Professor Dr. Deshpande, has started Bhasma Pishti Rasayan audio book. Very interesting name. Bhasma Pishti Rasayan audio book. Part 1 is finished. In the next lesson, we will start Bhasma Pishti Rasayan audio book part 2 in my next lecture. But till then, I request all of you, please subscribe my YouTube channel. Please give me feedbacks. I am very much obliged by sharing your feedbacks and I wish you all the best. Take care and see you soon. Thank you very much.